Hi everyone, it's another episode on Alice Nutritionals. Here at Alice Nutritionals, it's all about a lifestyle of healthy living. Don't forget to hit on the notification button, subscribe to our YouTube channel, and follow us on all social media platforms. Have you heard about the word HPV, which simply means the human papillomavirus? The human papillomavirus is the main cause of cervical cancer. This human papillomavirus can be gotten through sexual transmission. So human papillomavirus so over multiple sexual partners. So obi a member na ma oni omo edi agro won pemu edoso a we at risk so betimi nya sa HPV. Na HPV no a virus a eba ne mamu a e cause cervical cancer. Ba eba ne mememu a e na obehu se na enyema bi aba be sisi be ma no be ma ho. Inti no your friend what? Inti was a what no say vagina or friend vaginal what? It was about besisi ho ISM pompo na esisi ho. Sa HPV ya so ebetimi ama obi so enya ewo nenum. Inti enye se wasem ko na obetimi enya sa HPV. Wenum so ebetimi akose sa HPV no. Inti eno bo ni ebeba wase no sa mpompo nkete na ebesisi na ekro na ebesisi wo wase no. The same thing na obenya enso ewo wenum. Some of the signs and symptoms you should look out for when dealing with cervical cancer, or you should know you are at risk. You see and know that you are at risk of cervical cancer is when you easily get tired, that's constantly feeling fatigue and all that. Painful during sex. Sex is not supposed to be painful, it's supposed to be pleasurable. And if you are always feeling pain during sex, which forget about the size of the penis, once it's just a normal size and it fits perfectly, then like you should know that there's something wrong. You bleeding when you are not in your menstruation, or when you know you are in your menopausal age and you are still bleeding, it's also a risk factor. It's also a sign you should look out for. And also having these smelly vaginal discharge and constantly treating these vaginal infection and it's not going, and the smell becomes like pungent, you should also look out for that. Cervical cancer ya make sema the human papillomavirus bana. So say memfa ni say mpompo bia ba besisi o be ma ho ana say memfa ni say o kwafia kuma ne ho a e wo say say o at risk. Sa what ya make asemi enye wasen kwa na betimi aba besisi ebi wonu so awenum nti won se na wenum mpompo bia ba besi ho no, because ebi mo so ma oral sex and I say ebi a wama oral sex one ye bi no de aba bekisi won se so won se obetimi enya bi wo wenum and se mefa ni se wonya mbu nsa wonya menses nso na wo behu ana moja efri wase eba and nso so ye risk factor we se wo hwe. Also say member ni say oyo ebesiriwa na say we do menopause age mu, and so like nsa now all of a sudden when we say moja say nya some moja flow bi so eno so hwe uye bibi kakra na wa bre insio bi fifi wase a ebon san nyema we nyina e wo so hwe nti no these are some of the things you look out for, or you prompt yourself to go for checkup when you see these signs and symptoms. And you should also make sure that at least within like 3 to 6 months you constantly go for checkups and go and do this pap smear so that they can check if there's an HPV virus in it. Cervical cancer can be treated if it's detected early, but if it's not detected early, that one you would have to manage it for the rest of your life, and it's really dangerous. Some even goes as far as losing their uteruses and all that. So I'm creating an awareness of cervical cancer. You guys should look out for it and convince or try to encourage your women to also check out and do tests on it. There's also what's the name, a vaccine that can be taken to prevent cervical cancer. Visit the nearest hospital. Amanfo Polyclinic, we are there. We can also you can also come and we'll do the pap smear. We can give you the vaccine. We have a well woman specialist, because cervical cancer is more seen in women. But also look out for a man with warts on his genitals. If you are having sex with someone and you realize you are seeing some warts on his genitals or in his mouth, you should know that you are at risk of getting it as a woman. And some of the things you can do to prevent is changing your panties regularly, making sure you have one sexual partner. Making sure you have one sexual partner. You wouldn't be having sex anyhow. By heart. You have just one sexual partner. You also make sure you regularly check yourself at the facility. You take in the vaccine. You eat more fruits and vegetables. These fruits you can eat that can balance the vaginal pH are like grapes, like the grapes we have here, grapes, or any types of grapes, or cranberry, any of it. If you have these things, if you constantly eat it, it balances the pH of the vagina. Or pineapple is also one of the fruits that balances the pH of the vagina and also the smell, and also helps in like boosting libido. So you take in your fruits, you take in your vegetables, and also stop using multiple products, these vaginal products, injecting it in your vagina and all that. Sometimes it kills this vaginal pH and all that, which also invites other viruses into the vagina, which you can easily attract these viruses. So I'm encouraging everyone to take your nutrition health seriously. Drink a lot of water. Drinking a lot of water also helps in dehydration. If you are not hydrated enough, you realize that you always be having, like, you won't lubricate well when you are having sex. So also take in a lot of water, eat well and all that. As you know, it's your favorite nutritionist, Alice. I bring to you from Alice Nutritionals. Here at Alice Nutritionals, it's all about a lifestyle of healthy living. Subscribe to our YouTube channels. Follow us on all social media platforms. And don't forget to hit on the notification button for more. Bye-bye.